March is Colorectal Cancer Awareness Month. Dr. Oken is joined by Dr. Kester Crosse, who explains how important it is to have a colonoscopy, a 15-minute test that can save your life.
Hi, I'm Dr. Harry Oken for Columbia Matters. This month is Colorectal Awareness Month. Did you know that colon cancer is one of the most common cancers? The lifetime risk for an American is 1 out of 20. With me this month is Dr. Kester Crosse, a gastroenterologist in Howard County. Welcome, Dr. Crosse.
Thank you.
Tell us a little bit about who should get screened and when.
Well, glad you asked. The biggest thing is that Colon Cancer Awareness Month, the purpose of it is because although people know colon cancer is common, they really don't know that it is the second most common cause of cancer death in America. Lung cancer is the most common, with colon cancer being second. Breast cancer is third, and breast cancer deaths are going down mainly because of screening. So we really are trying to champion the screening process to lower the death rate from colon cancer. We have 50,000 deaths from colon cancer every year, and so these are the main causes of cancer death, and we really want that to decrease in America.
Now, what percentage of our population actually gets appropriately screened?
Unfortunately, great question. Only 60% of people who actually should be screened and can be screened get screened. Now, if we compare that to zero, we're making headway. But we still have 40% of people out there that aren't getting screened that should be getting this 15-minute test.
Now, by and large, screening begins at age 50, correct?
That's correct. Because of the risk of colon cancer, with a 1 in 20 chance of getting colon cancer, we recommend screening people at age 50. That being said, if at age 50 your colonoscopy is normal, we don't rescreen people for 10 years. So the fear, the thought of the colonoscopy actually keep people from getting a test that with 15 minutes can save their life. There are some subsets of people that we screen sooner. People that have a family history, if they have a mom, dad, brother, sister who have polyps or colon cancer before the age of 60, they should be screened in their 40s. If they have a genetic predisposition, there are a couple disorders that are in the genes, we screen those people as early as 18. And African Americans should be screened at age 45. And the reason is they're more likely to be diagnosed before the age of 50, and they have the highest death rate in the country from colon cancer.
Now, other risk factors for colon cancer.
The biggest risk factors for colon cancer, I mentioned genetics, and then their environment. There are actually things we can do, Harry. Our weight is a big risk factor. Smoking is a risk factor, and then diet. I like to touch on smoking. Smoking is a risk factor for heart disease, but also it increases our risk of getting cancer, so we should stop smoking. Weight is an unknown risk factor for colon cancer, and the biggest thing that people need to know is that if you have a normal BMI, your risk for colon cancer, getting it, goes down 25%. 25% reduction in just having a normal weight. What happens? Well, Americans overall are obese. African Americans are overall obese with 2/3, and so they have a higher frequency of colon cancer, higher death rate from colon cancer. Americans being overweight, obesity is a big problem, and we really want to push diet and exercise. That leads me to diet. What's a bad diet? High red meat, low fruits and vegetables, low fiber. People need to eat fruits and vegetables. And also, what I know you like to push is vitamins. Taking a vitamin lowers our risk for colon cancer, and even taking an aspirin.
Great information. So now let's talk about the test itself. Before the test, usually your primary care physician will refer you. You'll usually see them right before the procedure, possibly examine them, and of course they have to prepare their colon. Talk a little bit about the preparation of the colon.
Right. So by the time I get a patient, some have been referred once, some even 2 or 3 times. But that being said, the primary care doctors are really doing a great job of letting their patients know that they should be screened. So when I see the person, we're going over the test, try to minimize fears, because I find that the fear of the test, the thought of the test, is the biggest hill or hurdle that we have. So that being said, what is the biggest fear? We have a fear that, hey, I'm going to hurt, I'm going to have pain. They get great anesthesia, it's covered by the insurance, you're asleep. People do not have discomfort with the pain. They have gas with the test, but it's over. They don't even wear they have the test. The vast majority of patients, when we wake up, they say, I didn't even know the test was done. The biggest thing I always hit people when they tell me about the risk, I say, it is so much more riskier to not have a colonoscopy with a 1 in 20 chance of getting colon cancer and 50,000 people dying every year from this disease than to do this 15-minute test.
Right, so when you're doing the colonoscopy, you're using a flexible scope. and you're entering the
Yes.
rectum,
Yes.
and then take us through it.
So we take a flexible scope after you've done a liquid purge. So the bowel preps are the evening before, give you a laxative, cleans the bowels out. That truly is the hardest part. And we take a flexible scope through the rectum, navigating through this 4 feet of colon, looking for, in this case, or this patient here, would have an asymptomatic cancer, meaning no symptoms at all. This person will be walking around having a stage 2 out of 4 cancer with no symptoms. Liquid stool comes in the colon here, would solidify. They'd have a bowel movement, no bleeding, feel fine. Meanwhile, this tumor is growing in the lumen. They would only get symptoms when it completely blocks off, but as it grows out this way, it also grows out that way. The cure rate goes down to around 40% once it's growing outside the colon. Cure rate's above 90% when it's inside the colon. So that's why we like to screen people when they feel good, look good. I call them, if you're part of Young and the Restless, that's the time to get screened.
So having a colonoscopy early, particularly when you're asymptomatic, really saves lives. Now, there are 2 other possibilities you could find in terms of polyps. You can find a hyperplastic polyp, which has no malignant potential, and then an adenomatous polyp, which essentially tags you for future studies, correct?
Correct, yes. So if after 50 years of life you have a colonoscopy and you have no polyps, your risk of forming polyps in the future is very low, so we rescreen you in 10 years. If after 50 years of life you have polyps, 1 or 2, they get removed. And if they're adenomatous, which is the tissue type that can turn into cancer, we rescreen you at 5 years. There are certain people that have large polyps, or if you have more than 5 polyps, we rescreen you at 3 years. But that being said, the interval is years, and you're talking about saving your life.
Thanks for being with us this month. We appreciate all this great information.
Awesome. Thank you, Dr. Oken.